My name is Edwin Santana. I'll be the moderator. And I just want to do a quick little introduction with NeoGen, the history of NeoGen, the exclusive distributor of Emergent MedTech here in the US, and then lead it right into Dr. Lacerna. So Simon Jones is the CEO of Energist. Energist is a UK-based manufacturer that distributes the NeoGen, that you'll learn a little bit more about what NeoGen is and how it's transformed Dr. Lacerna's practice. And the team behind NeoGen here in the US is a small team, small but mighty. Rob Salisbury and Angela Lacey Salisbury. They are the owners and founders of Emergent MedTech. They have a great story. They started distributing NeoGen a few years ago. I want to say maybe 3-4 years ago now at this point, with a different distributor, and saw the potential that this device has, and became regional distributors for Energist, and eventually ended up outperforming all the other distributors in the US and gained exclusive distributorship with NeoGen. We do some really exciting things, such as advanced trainings that happen every quarter. We make sure that we empower our providers with knowledge and education. We're always going back to their offices to teach them some new protocols and learn new protocols from them. And the story kind of carries over to Matt Donaldson and Jeffrey Colster. Matt Donaldson is the CEO of Emergent MedTech, and Jeff Colster is the Vice President of Sales for Emergent MedTech. And I am the Director of Marketing. So any questions you have after this webinar, our team is happy to answer them for you. But without further ado, just a quick little introduction about NeoGen. NeoGen is an award-winning device, an award-winning treatment that has helped a lot of practices become award-winning practices. These are just some of the very best before and afters. One of them is actually from Dr. Lacerna's that she'll talk to you a little bit about on the top left there. But NeoGen is FDA approved for the entire body. It's FDA approved for all skin types, as you can see here. And it's won several awards, been featured in Vogue magazine, Women's Health magazine, and Dr. Lacerna will tell you a little bit more about what NeoGen is exactly. So Dr. Lacerna, I'd love to introduce Dr. Lacerna really quickly. She has an amazing story. I want to say over 20 years of experience being a double board certified plastic surgeon. She has over 20 years of experience in cosmetic care. She's certified by the American Board of Plastic Surgery, the American Board of Surgery, a fellow of American College of Surgeons, and a member of the ASP and the ISAPS. So very decorated, very knowledgeable surgeon. She's also the inventor of the plasma lift and the plasma brow lift. These are some pioneering techniques that you'll learn a little bit more that have really changed the field of aesthetic surgery, and has even gained some global recognition. Surgeons from around the world visit with Dr. Lacerna, and they observe her innovative techniques, how she's using plasma technology in surgery and in her med spa. She has a bunch of awards, and she's going to talk a little bit about some of her accomplishments, but she is an invited author with Dr. Kevin Chung for chapter 46 of the non-surgical rejuvenation and skin resurfacing section of the Graben-Smith's Plastic Surgery. That's the 9th edition book. An author of a couple other publications that will be coming out soon. She's won multiple awards with the Aesthetic Guide magazine and a few other accolades for outstanding surgery results, and is recognized by the International Society of Aesthetic Plastic Surgery with a gold medal for best face presentation. I can go on and on and on more about these awards, and I don't want to continue embarrassing you, Dr. Lacerna, but you do have a great story. You're really successful, and I'm really excited for you to share some of your secret with our folks here. So without further ado, I'll mute myself and take it away.
All right. Well, thank you so much for that amazing introduction, Edwin. These are my disclosures. Next slide, please. So I have been using plasma energy in my my practice for the last 8 years, since 2018 or so, and more specifically with NeoGen nitrogen plasma. since 2022 and have treated hundreds of surgical and non-surgical patients, very happy patients, happy staff, happy practice, happy doctor. So just as an introduction, everybody knows lasers, but a lot of our surgeons and dermatologists are still not familiar with plasma. So what are currently the different types of plasma used in the United States in medical aesthetics? There's 4 major kinds. You have probably heard of those plasma pens. Those use atmospheric air. There's argon plasmas, currently still just used in general surgery for coagulating, stopping bleeding, but there's aesthetic uses already in Asia and Europe coming up soon. Helium, I've used mostly helium, aka Renuvion in my practice, and of course, nitrogen NeoGen plasma that we're going to talk about tonight. Next slide, please. So what exactly is plasma? The most famous example of plasma, which is the 4th state of matter, is actually lightning. That's when you charge an electrical volt of energy into atmospheric air, producing a very powerful gas, 4th state of matter. So similarly with NeoGen, we use high frequency energy up to 2,500 megahertz into nitrogen gas, and this produces ionized particles. So you're going to have your positive and negatively charged particles that causes reactive species. So the mechanism of reactivity to the skin is both thermal and the activity of these reactive species that are actually really very interesting and unique to plasmas, and lasers, which are light-based, do not have this type of mechanism and tissue and skin interaction. Next slide, please. So this is one of my favorite slides. It shows not only the mechanism of NeoGen, but also how versatile it is. So we can basically divide its treatment modalities into low energy, that's up to 0.8 joules. That's your spa treatments, and also ideal for your higher Fitzpatrick 4, 5, 6 patients, or simply those patients who do not want any downtime, or they do not want, today I got this consult, I do not want my husband to know I'm spending money or getting any treatments done. The mid energy is your medium energy from 1 to 1.9 joules. So this is more for your Fitzpatrick 3, 4s, or also you could utilize the wet technique, which basically changes an ablative energy to a more non-ablative energy by using a conducting jelly, which we're going to go over that again. And finally, one of my favorites, I like high energy because I'm a surgeon, so I like wrinkles getting ablated right in front of my eyes. I like immediate gratification. This I usually use for those really deep rhytids, really sun-damaged skins, and I use it a lot in conjunction with my facelifts. So again, with plasma energy, you could see the plasma beam here. Centrally, you'll see the zone of thermal destruction. That's the area of controlled damage. That's the area of the epidermis that's going to slough off in a few days, but initially stays on as a nice biologic dressing. You can see the more important zone of thermal modification around this zone of thermal destruction. That's where you have your regeneration, neocollagenesis, neoelastogenesis. And you could see even at the lowest energy, this hits the the very important DEJ, or dermal epidermal junction, where most of our fibroblasts live and where they do neocollagenesis and neoelastogenesis. Next slide, please. There is a plethora of papers all over the world, internationally and nationally. These are all available in our Dropbox. This technology has been around since the early 2005s, etc. So that's all available in our Dropbox. Next slide, please. This has currently 7 FDA cleared indications for resurfacing and regeneration, namely for actinic keratoses, viral papillomas, ablating superficial skin lesions, seborrheic keratosis, acne scars, and more importantly, of course, facial rhytids and non-facial rhytids. Next, please. So this is how I use basically NeoGen plasma in my plastic surgery practice. It's kind of central. And what I say is this technology plays very well in the sandbox with your other toys. So more importantly, in surgery, I use it with my facelifts, my neck lifts, my brow lifts, my blepharoplasty, fat grafting procedures, and even in the body with liposuction because it does extra skin tightening. It plays very well with your regenerative technologies such as topical growth factors, PRP exosomes, because it has a unique plasma-assisted drug delivery mechanism that we're going to talk about in a little bit. It works great with skin tightening modalities such as Renuvion or helium RF plasma, safe to use with Vaser as well. And it works great with your other non-surgical technologies such as your suspension threads if you use threads, or your injectables and neurotoxins. Next slide, please. So I love toys. These are all the toys that I have collected over the years in both my OR and my med spa. And hands down, NeoGen is the #1 most used, the favorite non-surgical device by patients and staff as well. Next slide, please. So this is how NeoGen compares with the other skin tightening and skin resurfacing modalities. It does a full regeneration of the tissue architecture compared to your radiofrequency, your fractional microneedling, IPL, lasers, and HIFU technologies. Next slide, please. And compared to lasers, specifically CO2 lasers, mind you, I was a big CO2 laser user before my plasma journey. So I had my SmartSkin CO2 for about 7 years. I used it extensively before I started having my plasma devices. The plasma devices rock over any CO2 because of its mechanism. And it has NeoGen has way less complication rate published in the literature compared to CO2. Next slide, please. So this is a little video, if we could play, comparing NeoGen to CO2 laser skin resurfacing. So again, because the NeoGen, the nitrogen plasma, works with the impedance of the tissue or the resistance of the tissue. So the more hydrated the tissue, it kind of skips the stratum corneum, goes well into the DEJ and the superficial papillary dermis, hitting your DEJ, your fibroblasts, to cause tightening as well as regeneration. CO2 is more on the surface, it's more thermal. It thins out the epidermis and superficial papillary dermis instead of thickening it. If you look at nice, young, healthy, dewy skin, young tissue, they're thick, they're vibrant, not thin like CO2 treated skin. Goes up to 600 microns in depth. Next slide, please. So this is a nice little histological slide showing the histology of the skin immediately after NeoGen treatment. You could see the stratum corneum and the DEJ are completely intact versus compared to your RF microneedling with multiple holes and the CO2 laser with the fully ablated stratum corneum and DEJ. So it's you could tell that that's going to cause more inflammation, longer time of healing, longer erythema, versus when you keep that stratum corneum intact. Yes, it sheds in 3 to 5 days, but initially it acts like a very important biologic dressing that keeps decreases the pain during the and the inflammation during the initial recovery process. Next slide, please. So this is very versatile. So we like to talk about it as giving the patient an energy prescription. There's no cookbook here. The more you use it, the more you learn about it, the more you like it, and you learn what you can do and how much energy settings a patient particularly will need. So when I see a patient in consultation, I listen to their goals. Do they want a one and done treatment, ablating all of their sun damage and their wrinkles, or do they want no downtime at all because they have pickleball, or again, they don't want their husband to know they're doing something, or they're okay with coming back multiple times with the medium depth wet technique to see more efficacy with less treatments than the lighter treatments. Then, of course, I assess their skin, their age, their amount of hydration. Fitzpatrick went to 6. And then I start thinking, how can I address their aging, not only one-dimensionally just with the skin, because of course you get, as surgeons, we are trained and experienced to analyze facial aging and body aging 3-dimensionally. So would they benefit from fillers or fat grafting or Sculptra and neurotoxins? A very smart plastic surgeon said the way he analyzes aesthetic patients is he has 4 things: relax, resurface, regenerate, and refill. So if you think of those 4 modalities, every time you see a patient, both non-surgically or surgically, you hit all those. NeoGen is part of that equation with every modality. So this is really cool and unique to plasma energy, and uniquely specific and unique to NeoGen nitrogen plasma that lasers do not do. We again talked about the electrical energy, the gas producing ionized reactive plus and minus species. So these interact with the skin's phospholipid bilayer. As we know, all cells, including the phospholipid bilayer, has pluses and minuses. So when this energy is emitted on the surface of the skin, the reactive species, specifically nitric oxide, also interacts and produces oxygen reactive species on the surface of the skin. It realigns the pluses and minuses of the phospholipid bilayer, and it temporarily opens these like gates so that whatever topical medication, serum, vitamin C, regenerative exosomes you put on top of the skin, it's actually going to penetrate the barrier, the stratum corneum, without too much injury, get into the DEJ, get into the papillary and reticular dermis, where all your fibroblasts are, where all the healing and neocollagenesis and neoelastogenesis is occurring, and then before it closes back. So they've done really cool studies on this, NeoGen has, where they looked at the absorption of ascorbic acid or vitamin C as a standard without NeoGen and with NeoGen. So those blue columns show the time from 25 minutes to 8 hours, the amount of vitamin C absorbed in the tissue, versus the red columns are when it just sits on the surface of the skin. So anything you want delivered into the skin, this is going to help you with that. Next slide, please. So we talked about that. So David Letterman, I came up with my top 10 reasons why I love NeoGen for applications in my plastic surgery practice. Number 1, skin resurfacing. Again, we talked about that with high energy with my facelifts. We're going to look at case examples of that in a little bit. You could use this in your non-surgical med spa treatments, whether you do it yourself or with with other practitioners or mid-levels in your practice. You could use these on the low energy settings by your estheticians for a no downtime treatments. You could use it for a soft non-surgical blepharoplasty, or to enhance your surgical blepharoplasty. You could use it with multimodality treatments. Again, it plays well with all your other toys, your IPLs, your Renuvion, your Vaser, etc. It works great with surgical scars. So because this is so versatile, if you use a wet technique, it becomes a non-ablative plasma beam. So you could use it with atrophic surgical scars, or you could use it fully ablative. So you could use it on hypertrophic or keloid scars. So you could use it on any of those scars. You could use it on acne scars. This is really cool and unique, again, with plasma versus lasers. It helps with wound healing. And I'm going to share a case that I recently had. because of the nitrogen oxide it produces. It's antibacterial, antiviral, antifungal. It contracts the tissue and it also gently debrides. So it really hastens wound healing. It's great for hand rejuvenation. This is a great add-on for your facelifts because the telltale sign of a great facelift is their hand. If you don't match their hand with their face, people are going to know how old they really are. One of the very fast growing sectors in aesthetic surgery is vaginal rejuvenation. This does a great non-surgical vaginal rejuvenation of the labia majora, labia minora. Not only it enhances the appearance and the texture of the area, but it increases angiogenesis for sexual health and wellness. And of course, we talked about plasma-assisted drug delivery. Next slide, please. So let's start with eyelids. Next slide, please. So surgeons here in the audience will agree with me. The lower eyelid is the pancreas of the face. Of course, if we're trained in general surgery, we know we don't want to F with the pancreas. The same with the lower eyelids. We don't want to F with the lower eyelids. What do I mean with that? The picture shown below is a picture released by ISAPS of a severe cicatricial ectropion, which can happen whenever we cut skin on the anterior skin of the lower eyelid, causing injury to the middle lamella. And it's extremely hard to fix once it happens. So the secret is to not cut skin in the lower eyelids and to avoid that injury in the middle lamella. Next slide, please. So how do I do that? So just because I guess I suck at lower blephs, and no matter if I did a cantopexy or cantoplasties, I still had like a 30% risk of cicatricial ectropion back 10 years ago when I used to cut eyelid skin. So one day I said, okay, I have this technology. I'm going to stop cutting eyelid skin. And since then, I've never had one single ectropion, knock on wood. So how do I do this? I don't excise skin, so there's no external visible scar. Instead, I resurface the skin. Lucky for us, the skin on the lower eyelid is thin and very, very amenable to tightening and improvement with plasma energy. I do plus or minus fat grafting in the tear trough to the lid cheek junction, and plus or minus, if needed, transconjunctival fat pad excision through a transconjunctival approach. Next slide, please. So here's a little video of a non-surgical upper lower bleph. We can play that video, please. This is just with the topical BLT anesthetic, very well tolerated by the patient. I typically use anywhere from 1.5 joules to 3 joules, 1 to 2 passes. And then here I'm treating the lower eyelids. Again, this is just the non-surgical version, which is topical anesthetic. Sometimes you can give them a little Pronox too, and that just kind of helps them out and keeps them busy. Next slide, please. So here's an example of a patient with the lower eyelid treatment. So I did a transconjunctival fat pad excision for his protuberant fat pads, but you can recognize festoons. So the festoons are, of course, different anatomy from his lower eyelid dermatochalasis. And so it's very difficult to treat and correct. So what I did was, again, a transconjunctival blepharoplasty, removing his fat pads, and I treated his lower eyelid skin and the skin up to the upper malar area, lid cheek junction, and festoons with NeoGen. So this was 2 treatments with NeoGen. One high energy at 3 joules, 2 passes, and then the second one was just at lower energy, 1.5. Another patient, same thing, transconjunctival fat pad excision and NeoGen treatment for skin tightening of the lower eyelids, no skin excision. Next slide, please. A more recent patient is Fitzpatrick 4 patient. I did a transconjunctival a lower lid blepharoplasty, and skin tightening of her skin with NeoGen. I also treated her whole face due to her acne scarring with NeoGen, just one treatment, medium energy, wet technique. Note the improvement in her brow area. She looks like she had a non-surgical brow lift. This is a combination of a little bit of glabellar tox and NeoGen treatment with 2 passes of her forehead. Next slide, please. This non-skin excision, no ectropion technique really resonated with my colleagues in Greece for the ISAPS Olympiad that I won the the gold medal for face presentation. Next is the neck. Again, one of the more difficult areas to treat because it is riskier for hypertrophic scarring than the face, so it's less tolerant of very high energy treatments. The NeoGen treatment is perfect. This is a 69-year-old. She did not get a surgical neck lift or anything, just a high energy NeoGen, 3 joules, 2 passes. This is 3 months post-op. Next slide, please. And the more recent patient, 65 years old, just one NeoGen treatment. She had severe sun damage of her neck and chest, as you could tell. I did 1 joule, 2 passes, and 1.9 joules and 2 passes wet technique, and this is 2 months post-op. Full face resurfacing. Next slide, please. So this is an example of a spa treatment that my esthetician did. She did 3 treatments at low energy, 0.8 joules. Even with the low energy, you could see the marked improvement in her sun damage and hyperpigmentation. Next slide, please. This is a treatment I did. This is a real estate broker. She did not want any downtime. She's a smoker and a sun worshiper. I did this after 2 treatments of the wet technique. Note the improvement of her skin, of the sun damage. It looks like she had filler, but that's all new collagen synthesis and skin tightening. Next slide, please. This is a higher energy treatment, one and done treatment, 55 years old. I treated her whole face and neck at 4 joules, 1 pass and 3 joules in the neck and chest. Look at the improvement in her upper eyelids and her lower eyelids. This is a Fitzpatrick 4 patient, 68 years old. I did her neck lift years ago, and this is after 1 treatment with NeoGen of her face and neck. Next slide, please. This really handsome young man is my husband. So NeoGen is a great device to sell for male patients and grow that area of your practice. Why? Because men still need to look good, but they cannot hide under makeup and they do not want to look overdone. So it's really important to have nice, healthy skin. They also do not want too much pain or any downtime. So my husband, I treated him with the wet technique, and this is after just 1 treatment, 3 weeks post-op. Next slide, please. And this is his 3/4 view. Note the skin tightening and improvement in the quality of the skin of his upper, mid, and lower face and tightening of the neck areas. Next slide, please. Another male patient, 53 years old. This was just 1 NeoGen deep treatment, 4 joules. He loved his results so much, he cut off his mullet and has a more sporty hairstyle and looks great. Next slide, please. This patient is 64 years old. She is high profile, the wife of a local hospital CEO. She had an anniversary. She did not want anything surgical or a long downtime. So I treated her with a deep NeoGen treatment ×1 and Sculptra and some Botox on her glabella. And look at the marked improvement with the quality of her skin. Another patient with a combination of NeoGen and Sculptra treatment just after 1 treatment. Yes, she still has a little bit of rhytids in the perioral area, but the beauty of this treatment is we can always go back and it's not a big deal to do a little touch-up at no charge, just like you would do a little touch-up Botox, and patients love it. Next slide, please. Another deep treatment, 58 years old. I combined this with fat grafting, and this is high energy at 3.5 joules. and this is 6 months post-op. So this treatment with anything with volumization, either with fat grafting, such as this patient and the next patient, or Sculptra, if it's non-surgical, is magical. The analogy is, if you look at the dorsum of your hands and the palm of your hands, why does the palm of the hands look better? Because it has volume, so the skin looks better. So the dorsum of the hand always looks worse. So anytime you do resurfacing like this and you combine it with any kind of volumization, such as fat grafting or your regenerative fillers, they are more synergistic and more effective than alone. Next slide, please. We can skip this. This is just her testimonial. We already know how great she looks. So this is kind of exciting. So this is when I combine deep resurfacing with a facelift. So I called this my trademark procedure, plasma lift. When we address facial rejuvenation for patients, we age three-dimensionally. So I argue we should regenerate and rejuvenate them three-dimensionally. So after 20 years of practice, the perfect trifecta for me is regenerative medicine. That's combining fat grafting, PRP, and exosomes, energy-based devices, of course, with plasma, and deep plane face and neck lifts. Next slide, please. So there has been a long-standing dogma in our field that we do not want to do deep resurfacing on the same time as a facelift for the fear of necrosis or excessive damage to the elevated skin flaps. I now have a series from 2018 of over 100 patients. This was selected top 2 out of 800 abstracts in PSTM. Last year in San Diego, featured in PR's Global Open, and is an invited paper by the editor-in-chief. And I just recently submitted this to PRS last month, so hopefully it'll come out soon. Next slide, please. So I do this as a last step after I do the deep plane facelift first, then I do the fat grafting, and my last step is the NeoGen resurfacing. And this is safe to go all the way to the preauricular incision line on the areas of the elevated skin flaps. And I typically treat the whole face, the neck, and the chest, and just gives you that shrink wrap effect of your facelift. So it tightens up the new contours that's intended of what you wanted, and prolongs the longevity of your results and improves your long-term results as well, because they just have that beautiful, nice quality skin. This is that patient in the video, 3 months post-op. Next slide, please. This is a little video taken in the Image Pro showing the improvement of her skin quality. There you can see it's split face, and that's the after. Next slide, please. This is the computerized Image Pro analysis, and it decreased her skin age by 4 years. Next slide, please. This is a 63-year-old psychiatrist. I did her deep plane facelift, fat grafting, Renuvion brow lift, and full face NeoGen resurfacing. I wanted to talk about my plasma sandwich technique. So pretty much I'm a big Renuvion user and a big NeoGen user, and that's why I renamed my whole practice the Plasma Skin Center, because I love plasma. So I do a sandwich technique. So I use Renuvion subdermal for extra skin tightening, and then I do NeoGen on top. So they're synergistic and they work better together than separately, because you have one healing, you have the plasma thermal energy applied together, but safely, and you have more robust type 1 and type 3 collagen synthesis, because the tissue is like a lasagna. You're hitting it in all the layers. And so they heal and they work very well together, and their outcome is better. Next slide, please. This is her lateral view. Next slide, please. And this is her 1 year post-op. Note the continued improvement of her skin. Look at the improvement in the quality of her neck that you don't always achieve with the facelift or neck lift alone, and that dewy quality, youthful quality of her skin, but very natural looking. Next slide, please. Another patient, 55 years old, same deep plane facelift, fat grafting, NeoGen resurfacing, face and neck. Next slide, please. You could really see her skin laxity was more on the lower medial face. That's improved with the NeoGen. Facelift alone won't really give you that nice improvement. Next slide, please. And this is her neck down view. Note the improvement in the quality, even in her posterior neck area, that was improved by the NeoGen and not just the neck lift alone. This is an older patient, 80 years old. I did a high mass facelift, fat grafting, and NeoGen resurfacing. It's very safe even for that older skin that's very thin. Here's an Asian patient. She's gorgeous to begin with, but she's a big pickleball player and living in Florida. She had hyperpigmentation. This is after her deep plane facelift, fat grafting, and full face and neck NeoGen resurfacing. Next slide, please. This is great for your weight loss revolution patients, all your GLP-1 Ozempic weight loss patients. This patient, this is before Ozempic. She lost 70 pounds. Now she had all that skin laxity. And this is 2 months after her deep plane facelift, fat grafting, Renuvion brow lift, and full face NeoGen resurfacing. Next slide, please. Another patient, 71 years old. Note the improvement in her upper eyelids and lower eyelids. This is no skin excision. This is a deep plane facelift and NeoGen resurfacing. Next slide, please. Again, great for ethnic patients because you could use this for Fitzpatrick 1 to 6. 58 years old, deep plane facelift, brow lift, fat grafting, and full face and neck NeoGen resurfacing. Note the marked improvement in her lower eyelids. This next patient, this shows kind of your longevity of your results and your patients that keep coming back. So she's more gradual correction. She's already a beautiful woman. This was in 2019. Now 6 years later, she looks better. She has undergone a Renuvion brow lift, upper bleph, max facelift, and NeoGen resurfacing. So this is a great device to keep bringing your patients back for more. This is another surgeon's case. So they had a little bit of inflammation and impending maceration from a facelift and a neck lift. And this is when they started using NeoGen to gently debride the area of the maceration, decreasing the risk of bacterial infection because, like we said, the nitric oxide produced is antibacterial, antiviral, and antifungal. And it increases angiogenesis and also contracts the surrounding tissue. Next slide, please. Another case from another surgeon. Again, you could see a skin slough after a facelift, and this is after repeated treatments with the NeoGen. I really believe in this. I had a more recent experience of my own case. After 20 years, you've never had a skin slough, then you get a major one. I'm not able to share her photos tonight because of the patient did not consent, but I can talk about her case. The skin slough occurred immediately. The area was 6 centimeters length by 5 centimeters wide in the preauricular area. I started treating her with NeoGen and exosomes after every 2 weeks. And now she's healing like a preauricular scar, almost scarless. The amount of tissue contraction is amazing. The amount of regeneration, both from the tissue contraction and from the wound that was deep, full thickness, becoming more superficial and contracting into normal tissue is just amazing. Amazing also with the exosomes. The possibility of scarless wound healing is pretty much in our realm now, I think. Next slide, please. This was from another patient, a little suture fistula. that happened after a facelift, also treated with low energy NeoGen. Again, same mechanism, debriding and antibacterial and wound tissue contraction. Next slide, please. So next we delve into acne scars. So again, the difficulty with severe acne scarring is that they present more commonly in Fitzpatrick 4, 5, 6 patients, just like these next 3 patients I'm going to show. And so they are less amenable to deeper ablative laser treatments or your chemical peels. So this is a great tool for these patients. This is just after one low energy treatment with the NeoGen. This is another Fitzpatrick 5 Latino male patient, 50 years old, after one wet treatment, medium energy with NeoGen. Next slide, please. And finally, a patient who's 70 years old. I did her facelift many years ago. She came back to get her acne scars treated. And this is just after one treatment with the NeoGen and topical exosomes. Next case studies are hand and extremities rejuvenation. Next slide, please. Again, don't forget the hands, a great sell up for all your facelift patients because their hands need to match their faces. This is a great technique in conjunction with volume rejuvenation such as fillers or regenerative techniques such as PRP and exosomes. Next slide, please. This patient had crepey skin under the arms after liposuction. So this is after one treatment with NeoGen, medium energy. It really improved the quality of the crepey skin. A very difficult area that's highly requested for treatment in my practice is that crepey upper knee area. So this is after one deep energy treatment with NeoGen and topical exosome treatment. Next slide, please. Now this one is in conjunction with Renuvion. So you see her little entry point above the knees. So this one is a combo plasma sandwich technique. So Renuvion subdermal and NeoGen medium depth energy topically with and treated topically with nanofat and exosomes. Next slide, please. Again, surgical scars and wound healing. Next slide, please. We kind of talked about this previously. These are my own patients. So a little bit of suture granuloma treated with NeoGen, hypertrophic scarring in an Asian patient treated with NeoGen. Next slide, please. Again, this is good for both hypertrophic and atrophic scars. A little bit of skin necrosis after neck lift. I did the NeoGen debridement. Again, it's antibacterial, antifungal, antiviral. It works with tissue contraction and also causes gentle debridement. So it does it all for you. Next slide, please. This is the patient I previously presented after her deep plane facelift with her hairline temple scars. And this is 2 months after treatment with one treatment with NeoGen. Finally, I'm like the hair club. I'm not just the physician, surgeon. I'm also a NeoGen customer. Out of all my 15 devices or so, this is the only device I could use on myself. I have bad melasma and hyperpigmentation, and I've had 2 painless NeoGen medium energy wet treatments, and my skin continues to improve. This is in 2020. And this is in 2025. Next slide, please.
Yeah, I think that does it.
Yes.
Yeah, that is the, oh, actually, no. There's a couple more.
Just the last couple of slides about the books. Shameless plug. I don't make any money out of this. Again, please check out the non-surgical facial rejuvenation and skin resurfacing chapter that I wrote in Graben-Smith plastic surgery textbook. I specifically made a table of the different modalities comparing the different types of chemical peels, the different resurfacing lasers, IPLs, BBLs, microcore technology or EllaCore, nitrogen plasma, helium plasma, CO2 lasers. I talk about the mechanism, the depth of penetration, indications, possible complications, etc. So it's a good review if you're trying to decide what you need in your practice. And of course, I talk about NeoGen, and I have a video of NeoGen. And coming in 2026, I will be co-editor in chief with Dr. Elena Scholler. We are starting this passion project from scratch. It's written by all female board certified plastic surgeons. It's all non-surgical modalities. We call it aesthetic dermatology for plastic surgeons. This is going to enhance all your non-surgical and surgical outcomes. And that's all I have. Thank
Awesome.
you.
Thank you.
Please
Thank you.
feel free to email, contact me. We're open for observations, questions, and we're
Yes,
open for
lots of
question and
questions here. Lots of questions. So I'll start with the most recent one. Do you have experience with Cyton laser versus NeoGen?
I do not. Can you specifically speak what kind of laser and not just the brand? Is it CO2 erbium?
We'll find out what Paul said in a
And
second.
what nanometer?
Okay.
Yep.
So I will move on to the next question. Any use in post liposuction, hyperpigmentation, residual fibrotic tissue, or to smooth skin after lipo?
That's a great question. For bruising and hemosiderin staining, because plasmas are colorblind. So actually for that, what's more helpful are like light-based treatments. As I like the green LED lights. So you want to hit like the opposite of the spectrum. So you can also use your vascular lasers can work for those hemosiderin stains. And like a 1064 wavelength laser will work for that, or like a green IPL. So those modalities work with that. For the crepey skin, yes. This will work more for if you're trying to improve the quality of the skin. So yes, it will work for that crepey skin that can result after liposuction.
Paul got back to us about the Cyton laser versus NeoGen. He says the 2940 and 1470.
So 2940, I had a similar one that was by Palomar. So I believe that's your ablative erbium, because your 1540 is your non-ablative erbium, and your 2940 is your ablative erbium. So it's very similar to the 2940 as far as resurfacing. It's with the high energy side, but this is more tunable and more versatile, because again, you could do medium to low energy, and if you use the lower energy, then it's more similar to your non-ablative erbium or 1540s. And if you do the conducting jelly, it's even more protected of the stratum corneum, so it acts more like a non-ablative erbium. So in the 1540 range. So yes, it's similar, but it does both. So now when you're treating surgical scars, typically you would treat hypertrophic or thick keloid scars with 2940s or with the 1064 CO2 to shave it down. And with atrophic scars, you would use your 1540s or your non-ablatives, but NeoGen can do both.
Awesome, thank you. And then Haley wanted to know, how many pulses do you use for the eyelids?
For the what face? For the what portion?
For the eyelids.
Oh, for the eyelids, that's a great question. For the upper eyelids, I would typically go anywhere from 15 pulses to today I did 30 pulses on one eyelid. On the lower eyelid, I would typically do anywhere from 8 pulses to 16 pulses, depending if I do a double pass. I typically do a double pass. And my energy settings is usually 1.5 joules to up to 3 joules.
And do patients need to wear ocular shields when treating the eyelids?
That's a great question. If I'm doing a non-surgical eyelid, I do not use a shield. Like I showed in my video, you could use like a little rubber spatula to cover. I'm covering more the eye aperture as well as the eyelashes, because this can singe the hair follicles. It's not going to affect the root. It's just going to kind of singe the hair shaft, but it's not going to cause alopecia or baldness. but it just causes like a funny smell. So you want to protect hair bearing areas. If you're in the periorbital areas, you want to protect the lash line and the eyebrows.
Thank
But
you.
if I'm doing, okay, but if I'm doing a surgical bleph, I use a shield because I usually do a transconjunctival. So when I go behind the eyelid for transconj fat pad removal, I use a shield.
Thank you. Are you doing a series of treatments for NeoGen, or can this be a one and done?
All of the above. You could do a one and done deep treatment. You can do a one and done low or medium energy treatments and see how the patient responds. If they come in pretty severe, you could tell, like if they're really wrinkly or has really severe damage, but they say they don't want downtime. So I would tell them you would probably need 3 treatments or 4 treatments, 4 weeks apart. I would rather oversell them and tell them they're going to need more, and then sometimes after 1 or 2 treatments they're happy. so
That's
then
great.
you're not like over promising and under delivering, so to speak.
Managing those expectations, that's for sure.
Yes, absolutely. Goals and expectations.
Yes. Why is it better? Why is this a better alternative if someone already has a CO2 and RF microneedling device?
That's an excellent question because the CO2, you cannot use Fitzpatrick 4, 5, 6, number one. And number two, the papers we showed you, this has a way lower complication rate than CO2 lasers, as the literature shows. And number three, I had a CO2 laser before I started my plasma journey. I still have it. It sits in my office collecting dust. I would turn it up to 40 watts. I could not get the correction and the tissue health I'm getting with my plasma devices, if that makes sense. And the tissue quality, the CO2 laser is like a shaver, so it thins the epidermis. Um, so you don't get that nice dewy quality skin that you get with plasmas. Again, plasmas thicken the epidermis and dermis, not thin it. And if you look at young healthy skin, it's thick, it's healthy, it's dewy. And I was not getting that from CO2. RF microneedling, great question. I have an RF microneedle too. I have the Vivace system. They actually work together. The problem with RF microneedling, if you don't, at least for the Vivace system, unless you get the really aggressive non-insulated needles, if you get the insulated needles, it's going to skip your epidermis and stratum corneum and go straight to the dermis, DE junction for regeneration and tightening. That's all fine and dandy, but some patients need their epidermis treated. If they have a lot of deep wrinkles and sun damage, you have to treat both the epidermis and the dermis. So it's almost like the CO2 treats more the surface, the RF microneedle treats more the deeper surfaces. You have to do both, versus NeoGen can hit all those layers all at once. And you can I actually have used this not with the CO2, but with my Vivace microneedling. If I wanted an extra tightening, those jowls, those saggy necks, because I have older patients here in Florida, and some of them, they just don't want a neck lift. So that's my go-to. I would do a Vivace treatment, and I would do NeoGen on top of that.
So for your surgeries, are you building in NeoGen, or is that optional? How do you offer that?
So because like I have this trademark procedure, plasma lift, I always tell the patient I'm Michelin star chef, and this is my signature dish. You don't go to a Michelin restaurant and tell the chef how to make their signature award-winning dish. This is my award-winning dish. So I don't make it optional for the patient. I package my plasma lift. So and it's a tight protocol that I've developed over the last 8 years, starting with pre-treating the skin, with retinol based, or I customize the treatment based on the patient's skin. So they start that at least a month before the surgery. I do my own protocol healing cream with their PRP and nanofat and exosomes after surgery, and then they go to anti-age exosome based therapy post op. It's all protocoled. I include all of this in my price because if you don't, and you patients come to us for our expertise. Again, we're the chef. So if you have them line item it and remove key ingredients, you're not going to get the results that you're getting. So for me, they come to me because of my results. And so I don't give them an option. This is the package, and they say yay or nay.
Thank you for that. We have time for a few more questions. What is your typical protocol post NeoGen treatment?
So for my typical low energy to medium energy, it's very simple. I typically use topical exosomes, and immediately after treatment, because again, we talked about those ionic channels opening. So anything you apply to the skin gets absorbed through those channels that the plasma energy has opened up. Then I really like snail mucin. I like regenerative therapies, like if you're doing CPDRN from salmon sperm is huge in Korea, and plasma energy and NeoGen is huge in Asia. So all those modalities, PRP, moisturizing is really key. So I like snail mucin and laser balm.
Would you choose to use NeoGen to treat your patients versus using Renuvion?
For resurfacing or subdermal, or what application?
That's a great question. We'll wait to see what he says back.
Yes. And it also depends if they want surgical or non-surgical. So if they're surgical, if they have severe rhytids and sun damage and they're amenable to surgical, I would offer them both Renuvion and NeoGen, talk about the pros and cons, surgical versus non-surgical, and downtime too, because there's a significant difference in downtime.
That makes sense. And all Fitzpatricks, you can give them the same protocol?
Oh yes, that's a huge one. Well, Renuvion is only for FDA approved for the face, and it's only Fitzpatrick 1 to 3. NeoGen is FDA approved head to toe, Fitzpatrick 1 to 6. So that's also the huge indicator.
All right. And then some folks have said they have a soft wave, seems a bit similar. How is NeoGen more beneficial?
I am honestly not familiar with soft wave.
Okay.
So, I don't know if you are, Edwin.
Yeah, ultrasound technology.
It's external ultrasound, so like a HIFU.
Mm-hmm.
I think that they address different layers, kind of like in that diagram we showed. So I feel like HIFU would hit more the deeper layers, versus NeoGen can hit more the epidermis and the dermis and the deeper layers. And if you can do combined therapy, it'll even be more efficacious. Kind of like the same analogy as combining RF microneedling with NeoGen, like I talked about. It's the depth of penetration. I'm not sure the exact microns soft wave penetration is, but NeoGen is up to 600 microns. So those are all things to consider.
I definitely agree, and I mean we can resurface with NeoGen.
Correct, so and you can't resurface with HIFU. Yes.
Yeah, that's exactly right. Lots of questions here, so I'm trying to see who's submitted first here. Have you seen any combination treatments with your Palomar icon?
So that's a great question. So yes, so we have done, so again, the thing with NeoGen is plasmas are colorblind. So if you're trying to hit a specific chromophore, right? Like IPLs and lasers, they're light based, so they target water, melanin, or hemoglobin, right? So red, brown, or water. So if you're trying to specifically hit a brown spot or a pigment, you have to go really high energy with the NeoGen, because you have to hit where that pigment is. And it's not always necessarily in the epidermis. A lot of the pigment is within the DE junction and maybe a little deeper, because the 90% of melanocytes live in the DEJ. So, and I asked the dermatologist this, like, how can you tell where the pigment, like melasma, lives? Like, I have melasma. Can you tell looking at me, is it superficial or deep? Meaning, can I hit this with NeoGen, or do I need a deeper modality? Basically, she said you can't tell, but looking at the patient, you have to do a punch biopsy. So the answer is back to that, yes. So I have combined my yellow IPL, which is for pigment, so I would do a first run of my brown my yellow IPL. You'll see the brown spots turn black. So that means that you hit it. And then I would do NeoGen on top of it. So yes, combo treatment.
Yeah, and I saw one of your slides. NeoGen plays well in the sandbox
with the other toys. Yes.
With other toys, other treatments, all skin
Yes.
types, all ages, genders.
Yes. And I believe one of your top med spas also like to use combo IPLs and NeoGen.
You mentioned earlier in your slide that you're using NeoGen in the med spa. You're using it with surgery. Can you talk about who you're delegating this to?
Yes. So in the state of Florida, it's not categorized under lasers. So by law, you can delegate this to a licensed esthetician, to a nurse, to a mid-level, and of course physicians. Versus if it's light-based, then in Florida, you have to have, as an esthetician, you have to have a separate electrolysis laser tech license. But as far as I know, in Florida, that does not apply to NeoGen. So, but it's very safe, because this device has 2 hand pieces and 2 settings, a spa setting and the advanced setting. So at the spa settings, it only goes to 0.8 joules, and it has 2 different codes in your machine. So if you decided, I want my esthetician to use this, but I don't want them to go become a cowboy on weekend and start doing high energy treatments, don't give them the password for the advanced settings. So the 3-prong spa handpiece only goes from 0.5 joules to 0.8 joules, versus the 1-prong advanced handpiece goes up to 4 joules. So that's the way to do that.
That's great. Thank you. So another question referenced your ROI, your return on investment, right? And it sounds that you can make that up pretty quickly, seeing as how you delegate it.
Yes. I've had it for 3 years. It's almost paid, but it's already paid for itself.
Exactly.
Because of the amount, and we're not even actually really advertising it that much. It's a word of mouth with existing patients, and I lease part of my building to a dermatologist. And so my best poster I ever bought from you guys, this $80 NeoGen poster with your amazing before and afters, I put it right in front of dermatology checkout. We get like 5 inquiries a day just from traffic from dermatology.
That's great.
so it really is the best ROI, because the consumables are not that expensive. For each box, you get 5 hand pieces, and it's about $2,500. So wouldn't you say, Edwin, each advanced hand piece you could do, depending on, of course, the higher energy treatments, you have less pulses, but you can treat anywhere from 3 to 6 patients with 1 hand piece. Wouldn't you say, Edwin?
Yeah, that's exactly right. As you mentioned in your slides earlier, this is self-sterilizing. It's non-ablative. So the tip is reusable, treatment to treatment. So you do get, anywhere from 3 to 7 different body areas or treatments per tip.
Yes.
So
And the only other consumable would be your nitrogen tank. But you can purchase everything from Emergent MedTech. They also sell the conductive jelly that we use for the wet technique. They sell the nitrogen gas tanks. They sell the hand pieces and all your marketing. It's like a one-stop shop on their website. And I failed to mention this to Edwin. One of the great advantages of my plasma devices, they're workhorses and they're sturdy. I have over $1 million worth of lasers, and they are finicky, meaning if their mechanism, there's light optics, so there's a lot of little mirrors inside your laser. That's how they work, right? They have fiber optics. You move it a little bit, they break. And once they're like, Palomar was charging me like what they wanted to charge me $40,000 a year when the warranty was up, and these lasers break all the time. Someone will drop a handpiece. It was ridiculous. The NeoGen and the Renuvion, those my two plasma devices, have never broken down
they
ever.
definitely are
Because
workhorses.
there's work there because of the mechanics, right? It's just radio frequency and electrical source and your gas,
Yep.
then your handpiece. So there's no optics inside that that would break.
I wanted to just elaborate a little bit about the consumable cost. So when you're kind of taking an Excel sheet and considering all the consumables with the device, you do fall anywhere between $75 to $150 per treatment, depending on the number of pulses. And it's about a 90 to 95% ROI per treatment that providers are seeing. And as you mentioned earlier, it could be a one and done treatment, and that would be your higher ticket, higher energy treatment. But if you were to treat your darker Fitzpatrick's, you mentioned you do series. Typically, how many sessions and how far apart would you recommend? Generally,
Typically 2 to 3 treatments, about 4 to 6 weeks apart, and it's kind of depends on how they respond. So again, at the initial consultation, I tend to tell them like more treatments than they would probably need, and then if you're done like with 1 to 2 treatments, then they're happy because you didn't overpromise and underdeliver. So it's better to tell them that they're going to need more and then do less.
appreciate that. And someone asked if Emergent MedTech does offer training, and yes, we do offer training. When you purchase the device, you get your full hands-on training. You get consult support with your trainer. So we really encourage for at least the first 90 days that you're including your trainer with all the consults. As Dr. Lacerna mentioned earlier, there isn't one recipe that a size fits all. It's very custom, and that's what's great about this technology is we tailor it to the client's needs and goal expectations. So when you're practicing with your clinical provider, clinical trainer, you're able to pick up those recipes and figure them out and use them well after. But beyond that, we do quarterly advanced trainings in the Florida area, Boston area. We're expanding to other markets. This is something that we're all still learning. We learn new techniques. There's new FDA clearances that Energys is going after. There's new techniques. There's new protocols. So these advanced trainings are great opportunities for our providers to all share their success with it, and for us to elaborate more and empower our providers to make sure that they're using their device. It's not just sitting in the corner.
Right. And I encourage everybody to do that, especially the surgeons, because we tend to, most surgeons are like, well, my number one tool is my knife. Well, not really, because this can enhance everything you do with your knife. Number one. Number two, I always say this when I give talks, please really learn your device. Don't just buy a device and delegate it to your PA and NP and not learn it. Learn it, play with it. This is a sports car. First learn how to drive it and then learn how to race it, and you will know the physics of it, know the chemistry of it, know how it affects the physiology of your skin. This is the only way we get better, is if you play with it and you see what works and what doesn't work, and how it all fits together with everything else we've learned in medical school. So but it's really cool. You could really geek out about like all the ions and the nitric oxide and this kind of cool stuff, you know. So yeah, so please get it, play with it, use it, and then delegate it, because then that's how you get the best outcome, because you can guide your esthetician. Because this is just in my practice, and it's not anything negative, but our way of thinking and their way of thinking is very different. They're very cookbook. So it's, you know, they see one type of skin, this is how they do it. You're the physician, you know the physics, the chemistry, the physiology, the anatomy, and all that, and how it all works together. So when you understand your device, you know how to treat this problem, and you can tell your team how to do it that way, versus just delegating. You don't know your machine, then how are you gonna have the best outcome? Because you're not gonna play with the parameters.
That's exactly right. That's exactly right. Well said. We have a ton more questions, but unfortunately we're out of time. The good news is Dr. Lacerna will be joining us at ASLMS in Orlando. I believe it's the last weekend in April. NeoGen has a booth there. We also have a classroom where we're going to have speakers like Dr. Lacerna present, hopefully do a demo. I see Dr. Jack Zamora on here as well, asking some funny questions. He
Dr.
will also
Zamora,
be there as well.
hi, my idol.
Yeah, so he'll be there that weekend as well. So
Yes. I will also be at the Aesthetic Society, the meet in Austin in 2 weeks. I'm teaching a skin resurfacing plasma course, so it's like a plasma 101.
That's great.
Yes.
That's great. So there'll be plenty of other opportunities where you can meet Dr.
We'll
Lacerna
post
and ask
that
her any
too,
questions.
So, yeah.
But thank you so much, Dr. Lacerna. Anything else? Any closing remarks that you have to mention? I know you said a lot, but is there anything that you feel that you have missed?
No.
I think you said it all. I think you said it all.
And please email me or Edwin for any questions. Happy to answer and happy to help.
Awesome. Thank you all so much, Dr. Lacerna. Our pleasure. Thank you for helping us pioneer this technology and push it to its limits, explore different boundaries. And I'm so excited to see you at ASLMS in April.
All right. Thank you so much. Have a great evening. Thank you, everybody.
Bye-bye.